Hi, I am Dr. Shashidhara G Matta, working as a general surgeon in Manipal Hospital Whitefield. Today I want to talk to you about anal fistula. Fistulas are common after having an incision and drainage of an abscess. 33% of the people who have a perianal abscess will do present after 6 months or 3 months after an abscess drainage with a fistula in it. Fistula does come because of anal gland infection. Anal glands are specialized glands which are there in the just inside your anal canal. They are all microscopic glands. They do not have any function in the human beings. They used to be having a good role in lower vertebrates like cats and dogs, where they used to function and herald the onset of mating season. But in humans, they do not have any sexual role. But they are a nuisance. When they get inflamed, they usually present as perianal abscesses. Once the abscess is treated, if the internal opening of the anal gland is persistent, you will end up with a fistula. The fistulas can spread. Fistula tract can go in different direction. Sometimes it can be just below the mucous lining of the anal canal. Sometimes it will be between the two sphincter muscles. Sometimes it can travel across the sphincter into the perineal skin. And some of the complex fistulas, they do travel above the pelvic floor muscles, and they can have a horseshoe course wherein they will be encircling half anteriorly or posteriorly. It depends on the fistula infection and the tract. Though these patients do present with pain and a never healing discharging wound around the perineum, which will cause them this inconvenience for 2 to 4 weeks. Afterwards, they will feel a lot better and they will ignore. The problem with ignoring the fistula is the tract will keep diverting. It will become more complex as the time passes. The best way to evaluate is to get it examined and do a limited colonoscopy or a sigmoidoscopy to evaluate and exclude any other inflammatory bowel disease which can also contribute to anal fistulas. Once we excluded inflammatory bowel disease, which is the least common cause in the fistulas, the commonest cause is the infection of the anal glands. Once we confirmed it, we do a special scan, either with the endoanal ultrasound scan or a MRI scan. Depending upon the results of the MRI and the ultrasound scan, we decide what surgery needs to be done. If the fistula tract is not involving much of the sphincter muscles, we can go ahead and lay open the fistula, what we call low fistulectomy. But if the fistula tract is involving more than half of the internal or the external sphincter muscle fibers, then fistulectomy may not be the right choice. We might have to think about doing an intrasphincteric ligation or a fistula coring or an advancement flap or a sit-on insertion, depending upon the nature and the severity of the tract. Well, the surgeon will discuss with you the pre-op investigations and the blood and the pre-fitness for surgery investigation, and then tell you about the course of the post-op recovery. If it is a low fistulectomy, most people will take 2 to 4 weeks to heal up, and they get better within a few weeks. The people do consider a laser surgery for a fistula. The laser surgery have a higher rate of recurrence compared to gold standard fistulectomies. You need to re-evaluate the advanced technologies. They are not yet able to reproduce the high cure rate for as much as the surgical excision. Thank you very much.